Hello and welcome. The global COVID-19 ground zero has shifted to India now, as the Wall Street Journal put it, with over 100,000 cases being recorded just 2 days ago or day before yesterday. The latest tally is about 96,982 cases in one day across India, of which almost 76% is just with Maharashtra, Karnataka, Chhattisgarh, Kerala, and Punjab, with Maharashtra being the major domo here when it comes to COVID-19 cases. Now, the question as we look ahead is two or threefold. One is, how is it that the number of COVID-19 cases have shot up so dramatically and so suddenly? Are these cases following patterns that we saw earlier? If so, what have we learned? And can we learn even at this point, while it does appear in some ways a little late? Secondly, what are the similarities in terms of the way the disease itself is behaving between what happened last time and what's happening today? And while the case fatality does seem lower, is that something that we should take for granted? And if not, what should we be doing? So broadly, what are the lessons from earlier? What are we seeing today? And what might this become if things progress in the way that we're seeing? To discuss this, I'm joined by Dr. Ramanan Laxminarayan. He is the founder and director of the Center for Disease Dynamics, Economics and Policy, the CDDEP in Washington, D.C., also a senior research scholar at Princeton University and affiliate professor at the University of Washington, and someone who's been doing a lot of work from the epidemiological point of view on COVID-19 right from the early 2020. Dr. Ramanan Laxminarayan, thank you very much for joining us. So let me ask you to first tell us, how are you seeing it this time? Did you see it coming, firstly? And how is it different this time, particularly in India?
So Govind, the second wave was always going to happen. The question was the size of the second wave. And you have to remember a few things. One is that the size of a wave is only apparent to us through testing. Today, we're doing far more testing than we did 1 year ago. So if the wave appears to be bigger, it's not necessarily bigger. It just means there's a lot more testing going on today compared to a year ago. That's one. Second is it is going up quite fast. And that's because a year ago, the country was under a lockdown. So the rate of increase was going to be much slower because transmission was slower. Today, it's uninhibited. So we get a taste for what COVID looks like when there are no restrictions. And we can imagine what the country would have looked like a year back had there been no restrictions at the same time, post the 500 cases when the lockdown was put in place. You have to remember that COVID works with a lag. It works with roughly a 10-day lag for infections, and then a 10-day to 2-week lag post that for mortality. So everything that we see happening now was dictated by behavior that happened 2-3 weeks ago. And 2-3 weeks ago was when there was a feeling that COVID was firmly in the rearview mirror. And although it is subtle, and people say, well, but there wasn't a huge amount of change with respect to compliance and mask wearing and so forth. There was. And the virus pretty much responds to human dynamics at this point. Its dynamics are driven by how we behave. And what happened a couple of weeks ago was really that there's a lot less care about COVID. Right. People just saw it as going away, and therefore there's a second wave. Now, the last thing I'll say here is that, from a purely sort of theoretical understanding of disease, the size of a wave, and keep in mind again, the size of a wave is not exactly what we see. We only pick up what's picked up by testing, maybe 1 in every 30 cases. But the actual size of a wave is really determined by also the strength of the lockdown, and subsequent waves depend on the strength of the lockdown. So countries in Western Europe which had very significant lockdowns which were effective because they have smaller populations saw multiple waves. India probably saw a much bigger wave in the first round, lot more people infected, and therefore it takes a while for it to come down and for the second wave to pick up again. So my expectation is that if it's hard to predict what will happen here because it's entirely going to be a function of what restrictions are in place. But any restrictions that are put in place today will not see an effect for at least another couple of weeks.
Are you arguing for restrictions at this point?
I'm not arguing for restrictions. I'm just saying that, okay, let me put it this way. I think there should be restrictions which are highly localized. This is the sort of thing I had argued for in March 2020. And then I realized that what the government did was the only choice that it had, which is that in the absence of evidence on where the disease was, in the absence of healthcare facilities or of doctors knowing what to do with the disease, they chose the blanket restriction, which was nationwide, in the hope that that would sort of delay things, and it did. It certainly made a huge impact. Our data show that comprehensively. At this point in time, I think local jurisdictions have much better information, and I
Right.
think as cases go up, people will also protect themselves a lot better.
Right. So you talked about last year where you had also projected at one point that the country would likely see several 100 million people being infected by the virus,
Yeah.
either symptomatically or asymptomatically. How do you look at that today? And are we in some ways seeing a repeat of that situation? And secondly, isn't there a case that, when a lot of people get infected, they also don't get infected again? And to that extent, did we actually get infected the last time?
So, great question. We probably did have a few 100 million infections. In fact, the ICMR's own second seroprevalence survey estimates that we underestimated infections by a factor of at least 30. This is ICMR's own paper in the British Medical Journal. And so, if that is the case, and we saw about maybe 10 million cases, you're talking about at least 300 million cases, if not more, in that first wave. My guess is it was upward of 400 million cases. That said, 400 million cases in a country the size of India is still, short of the 1.4 billion population. So there's still a lot of people who are not infected. And anecdotally, I think the people that I'm seeing infected in this round are people who are sort of wealthier. They managed to stay indoors during that first lockdown phase. And they all came out during this phase, either post-vaccination or even pre-vaccination, in the assumption that this has gone away, and entire families have been infected that way. Of course, this is anecdotal evidence. We don't have firm data on this. But I suspect that the people who are getting infected today are different socioeconomically than the ones who got infected in the first wave, who were largely the urban poor.
Right, and therefore you're saying that, let's say that was one half of the population and this is the second half, adjusting for demographics, is really what is going to face the brunt and is facing the brunt right now.
Absolutely, and this will continue until this wave also passes. And there is, of course, the question about variants, which I'm sure you'll want to ask me about. Now, the variants are really the big unknown in this entire scenario. Actually, put the variants, in some instances, can be thought of as a completely different virus. So it's all coronavirus, but if the virus changes its spike protein, then we're dealing with something different. And we are not sure at this stage if people who were infected last year can be reinfected this year by a variant. That still remains to be determined. What we do know is that the vaccines are not perfect protection. We've seen a number of people infected even though they've been vaccinated, but no surprise there. Vaccines are only 60-70% efficacious, and at best. So I think we will see a new set of people being infected, but possibly some of the old set also having infections because of potentially the new strains.
Right. Now, let's look at lockdowns. I'm in Mumbai city, and you're presently in Bangalore. Mumbai has and Maharashtra state is going into a semi-lockdown. There is curfew. Weekends will be shut down. Delhi city has now announced. Delhi city and state has now announced night curfew. Now, given all of this, and maybe other states and cities may react similarly in down the line, do you see the progression changing, and could you maybe articulate two situations, one as things stand and one assuming there is further lockdowns of the nature we are seeing, and how would that, what would the final tally, if so, look like before it starts peaking out?
It's hard to tell again because it's not just the lockdowns, right? It's also got to do with how people actually actively change behavior, and there's a lot of confusion out there. One day cinema halls are open in Karnataka, the next day they closed, then they had 50%. So there's a lot of knee-jerk reaction because the economy is open back up, and people are, and policymakers are reluctant to go back into a situation which could impede the economy. And movie halls are just one example of it, restaurants and so forth. So I don't expect just the night curfews or these single measures to have a significant impact on the transmission of the virus. Unfortunately, the only real change will come about right now because people comply better with masking because they are scared of getting COVID, or people stay indoors because of COVID, that's a much more powerful force on the virus than really an imposed lockdown on the outside.
Right. Are you seeing any other external factors or aspects behave at work here? For instance, in the West, winter seems to lead to increase in cases. In India, it's summer, and quite contrary to maybe one of the earlier beliefs that as the temperature increased, maybe the viruses would start coming under some kind of strain.
Honestly, we've never had good evidence on this, to be honest. In
Right.
fact, right from the beginning, I've said that there is no real evidence linking temperature, or actually the more popular link was with humidity. And there was a theory that higher humidity would make it difficult for the virus to transmit. We saw it transmitting quite freely in Tamil Nadu and Kerala, for instance, which are pretty humid. So, as far as I'm concerned, there is no conclusive evidence on climatic conditions and viral transmission. This is purely a function of just ebbs and flows of the virus, which are driven at the end of the day, like I said, by our behavior.
Right. So, if you were to now look ahead, Ramanan, how are you, and what do you feel policymakers should be looking at? As in if there was a dashboard with just 4 or 5 bullet points, what should we be focusing on, and how should we be now rallying our efforts or converging our efforts?
I think first I'd look at test positivity rates. We have to remember the testing is much higher today. So I would say that, the test rates are higher, but test positivity rates are still lower. So we need to pay attention to that. We need to pay attention to genetic testing for variants to systematically track where those are and see if there's a correlation between that and the severity of disease, numbers of people in hospitals, and mortality. That's a really important piece of the puzzle. If we find that going up, then it means that we're going to have to rethink our vaccine strategy itself, because, for instance, we know that some variants do not respond at all or are unaffected by the AstraZeneca or the Serum Institute Covishield vaccine, which would then mean that we would have to change our vaccine policy to switch to something quite different at very short notice. We would probably want to pay attention to increase testing in places where there's not enough testing. I'm often asked the question, why does Maharashtra have so many cases? It's very simple. Maharashtra has a lot of people. Maharashtra is highly urbanized. It's one of the most urbanized states in the country. So there's a lot of urban agglomeration. And then the third is that Maharashtra just does a lot of testing because it has a very good health system. So it's no magic there, but we really don't want to get this out of control in places that we know did not have big epidemics in the first round. It could be Orissa, it could be parts of Telangana, it could be Madhya Pradesh, Rajasthan, UP, Bihar, where potentially not as many people have been infected in the first round. So I'd also look at spatial spread and see where it was spreading to get ahead of it. Again, lockdowns or any restrictive measures are not very useful once the virus has started transmitting, because then it's a 2-week lag. So we'd want to see where it's taking off now and impose the restrictions now rather than in response to a spike in cases.
Right. So last time, for instance, it appeared, and do correct me, that it largely started on the western seaboard in India and then started moving central, eastward, and of course north. Is it likely to follow a similar path, and therefore we've obviously got much more difficult days ahead, or could it be different?
It could be entirely different, because at that time it was not western to east. It was mostly international airports out from the international airports. So it was Delhi, Mumbai, Kerala for Gulf returnees, and Chennai, which are the places. And of course, UP, Bihar don't really have international airports, so those were not the first places where there was infection. There was Punjab as well, and Gujarat. In this particular round, the virus can really show up from anywhere. I mean, we see the so-called UK variant being quite prevalent in Punjab, for instance, potentially because of people moving back and forth there. So I don't think we'll necessarily see the same kind of spatial spread, or that's even possible to predict what that spatial spread will really look like. But I would look for cases and variants in places that appear to have low levels of cases now, and take proactive action rather than be reactive, because with this virus, there is really no point being reactive. It's just too late for Maharashtra at this point, for instance, to respond with night curfews. I know they have to be seen as being responsive with something, but that time to have done it would have been, a few weeks ago. And let me admit, this is hard stuff. It is not as if even epidemiologists have a good handle on when it's going to come back or where, that someone could have told the Maharashtra government, be prepared for this. We are learning about a new virus and learning as we go along, and we have really no template for this. So, it's hindsight is 2020, but it's very hard to look forward to see how things are going to move, because the big variant here is, apart from the viral variant, is really about the human behavior variant.
Right. So, I mean, two linked questions. So, one is that, it did suddenly, I mean, we saw the peak in the end September 2020, and then it started going down from about a little over 90,000 cases. Of course, we've crossed that now, and it started going down. So, something triggered a turnaround and it dramatically shot up again. So, what is the lesson on that? Because, if we are here today and assuming we were to go down, then things could turn around again. And what, how do we even prepare for that?
So again, remember the dynamics. In the first round, we were under severe lockdown from day one. Virus still keeps continuing to rise because you can't stop transmission amongst the urban poor or living in very close quarters with each other. So it does take off, and everyone who was within striking range of the virus at that point got infected. The reason why it starts coming down is everyone within striking range is already infected, they are immune, but the virus has not yet managed to reach either the rural areas in full force. It has also not managed to reach the urban, wealthier middle class who are sitting in their homes and working on their laptops or wherever, but not really exposing themselves to the virus. So that peak starts coming down at that point in time. Until such time that this bunch also starts going outside and says, okay, now it's fine to go out, in which case the virus finds new prey and starts coming back up. So this pattern is very much dependent on us. And you will see that over some time, as vaccination picks up and people start taking precautions, and as immunity builds up in this population, it will start going down. I think the cases will start going down. But I think at this stage, the cost of measures which are like stringent lockdowns as a main way to bring the virus down are likely to be extraordinarily expensive, number one, and number two, not terribly effective either. I think the main way in which we can bring it down is really by two. One is advertising how severe the problem is so that people respond with their own behavior. I think that's the most effective. And second, of course, reinforcing that message again and again. And you don't have to tell people not to go out. If they see there's a lot of their neighbors getting COVID, they themselves will not go out.
Right, and I guess we're seeing a little bit of that anecdotally already. So we're at about 100,000 cases right now, Ramanan. How worse could it get, if at all? And if things were to converge, or everything were to converge with our vaccination efforts, which also is gathering steam, where do you think it could land, at least from a modeling point of view?
So from a modeling standpoint, remember that 100,000 reported cases is probably more like 2 to 3 million actual cases per day. That's just, we only have partial visibility. Not everyone's getting tested, right? There's not even the testing capacity to take on all these people. So you're talking about some 20, 30x of that number, probably even more, who are getting infected at this point in time. Now, the vaccination is progressing at the best pace that it can, given current constraints, which is about 3 million a day. Now, we're able to do 3 million because we had a backlog from manufacture from October, November. India's actual vaccine manufacturing capacity, without accounting for exports, is only just over 2 million a day. So it's mostly serum and another 10-20% which come from Covaxin. So we're going to not be able to do 3 million people in at least the next month or two because you just don't have enough vaccine. And it's only a matter of time before the people who paid for the vaccine are going to want their vaccine as well. And that's going to run into some rough weather as well. So at the current rate, if you're going to do only this rate now, 2 million a day, it's going to take us 2.5 years to get even 70% of the population, starting from where we are, 70% of the population fully, vaccinated with 2 doses. 2.5 years is a very long time away. So I think the vaccination is going to be part of the strategy, It's eventually the final, strategy that we have. But in the short term, it's really going to have to be people taking precautions themselves. And I think visibility into the virus, visibility into the variants, visibility into the consequences of the disease are the most important. And I've said this many times before. It is a myth that case fatality rates are actually lower in India. Any systematic evidence that we have gathered based on literally millions of contact tracing show that case fatality rates in India are no different when calculated correctly than in other countries. We also realize that, there's all those India exception myths. Those are simply not the case. And the damage they do is in telling people that, oh, but this is not so serious. It may be serious in the US, it's not so serious here. That's just not the case. I think we have to deal with this disease seriously, but the other side of this coin is that I also don't think that dealing with it seriously means, shutting down the country and the economy.
Right.
I think that made sense a year ago because of the peculiar circumstance and the speed at which the virus was coming at us where nobody was prepared. But that really should not be our weapon at this point.
Right. And last question, in a way, seeking an emphasis or a re-emphasis. You're saying that therefore, get it out of your head that there is any exception in India, or we have any exceptional or exceptions to the way we react, behave, disease response, anything. We're exactly the same as anywhere else in the world.
The only thing that makes a difference for us is two. One is we're a much younger population. Right? So 65% of India is under the age of 35. That block of people which don't develop severe disease in general is really what protects us. So once we take away account for that, then the rest is exactly the same. The thing that works in our favor is that our people who are above 75, 80 in India tend to be oddly enough healthier than the 75 plus year people in other countries simply because of what is called, it's just selection bias. It is that people in our country who made it to 75 are generally healthier to begin with, because otherwise they would not have made it to that age. But we have a dangerous age group, which is between 45 and 75. In that age group, case fatality rates in India are sharply higher than in countries like China, Brazil, Italy, the US. And that is the age group that really worries me the most. So, and that is because we know that, because comorbidities are the single biggest driver of severe disease and mortality from this. If you're not diabetic or hypertensive, you don't have COPD, you're not obese, then your risk of severe disease comes down significantly. So right. It's strange. It's an infectious disease, but it's actually a disease which gets us for non-communicable disease conditions. So when you add that picture up, then there's cause for concern because of this middle age group, but there's also the young people who protect us, and that's also something that we need to be thankful for, I think.
Right. Just the last one, since you did mention young people, there's been a lot of, not a lot, but at least some people have very sharply opined that we should vaccinate young people first. And I think Indonesia has done it, and others have maybe thought about it. Should we have gone that way? Should we still, is there still time to reverse that or change that course?
I would not do that for the simple reason that the vaccines that we have do not prevent transmission. Generally, you vaccinate young people because then they don't give the disease to other age groups. In the case of COVID, as far as I'm concerned, the biggest value of the COVID vaccine is in reducing severe disease and mortality. It's not even necessarily, you may still get a milder form of the disease, but if you get the vaccine, significantly lowers your chance of dying of the disease. Right. So when that is the great value of the vaccine, why would one waste that on the younger age group? Give it to everyone in the 45 plus age group and focus on just that, and control your transmission through other methods, because we have no evidence that giving the vaccine to a 20-year-old is going to right. prevent the 60-year-old grandparent living with them from getting the disease. We have no evidence of that.
Right. Dr. Ramanan Laxminarayan, thank you very much for speaking to us, and do hope to catch up with you again. Thank you.
Good to see you, Govind.